Hi, I'm Isabella.
I'm Alex.
I'm Katrina.
And I'm Alexandra, and this is Bioengineered Stents.
Heart disease is the leading cause of death in the world, and within heart disease, coronary artery disease is the number one, with 7.8 million deaths in 2020. Stents are used to treat coronary artery disease. This is a disease where there is a plaque buildup due to numerous reasons like smoking, diabetes, and the types of food you eat, and plenty more. This is seen as a global problem, and more cases are seen in urban areas because there's more access to those causes of coronary artery disease. And restenosis is when the artery starts to narrow again after the stent has been implanted. With our stent, we are looking to create one that will lower the restenosis, which is currently 7 to 13% in drug-eluting stents.
We want to create a new age stent with a multi-layer coating that reduces in-stent restenosis at a higher rate than current drug-eluting stents. We will utilize a modified anti-human CD34 antibody to capture endothelial progenitor cells. The stent will consist of a 316L stainless steel body and a multi-layer polypeptide coating. CD34 promotes a re-endothelialization and accelerates vascular cell adhesion to the stent. Vascular endothelium cells have a CD34 binding receptor on them. After binding, the cells will adhere and proliferate on the stent. Our goal is to create a coating that has immobilized anti-human CD34 antibodies and is hemocompatible and cytocompatible.
So I'm going to be going over the costs and benefits of our project. Our bioengineered stent is made to promote the natural healing and formation of the new endothelium cell lining. This is done by capturing endothelial progenitor cells and triggering a response that creates these CD34 antibodies to recruit these epithelial cells. A new cell lining will in turn be created using these immobilized antibodies using the EPCs, inflammatory cells, and platelets within the blood. This new cell lining will in turn reduce the risk of restenosis as well as thrombogenicity as the new layer of endothelium is created. So the development of stent technology is really important as there's over 2 million stents that are implanted per year within the US. In the pre-stent era, the occurrence of restenosis ranged between 32 to 55% of all angioplasty surgery, which is really an alarming number that was in turn successfully dropped to 17 to 41% with the development of bare metal stents. On today's market, the development of drug-coated balloons along with drug-eluting stents have further reduced this risk of restenosis to under 10%. So the cost with our project, current bioengineered stents do not really outperform drug-eluting stents overall at the moment. Several trials have been done showing little outperformance in containing specifically late lumen loss, which is directly correlated to binary restenosis. So one of the most common use stents is called a sirolimus eluting stent. In the US, this is priced at around $2,500. And the average price of angioplasty costs around $25,000 and can go up to $125,000 depending on how extensive the surgery is, with the average price being lower around $30,000 for Americans with insurance, though this cost is averagely much higher for people who do not have insurance.
So there currently aren't any epithelial recruiting stents that are approved by the FDA, but we can talk a bit more about the popular stents on the market, mostly bare metal stents and drug-eluting stents. So Boston Scientific is considered one of the leading competitors in the market and has a very strong foothold in the drug-eluting stent market. They offer 6 different kinds of stents. However, I'm going to talk about their Synergy line for a moment. It is currently the only drug-eluting stent approved with a bioabsorbable polymer coating. And unlike permanent polymer DES coating, this stent is its polymer is gone shortly after the drug has been completely eluting. And then another company that is to note is Medtronic, and it also has a very strong foothold in the industry. And they offer 3 different kinds of stents, but to look into their Resolute series, that is a platinum copper coating and is considered different by design as it's flexible and has a single wire design. But with our stent, we aim to decrease in-stent restenosis and aim to increase the success of the stent's integration into the coronary artery. Our stent is an improvement because we are no longer using drugs. Instead, we are using an antibody to recruit epithelial cells. So we'll be using a multi-layer of CD34 and macromolecule coatings, therefore having a better chance of coating and immobilizing CD34 to recruit epithelial cells in order to improve the percentage of failure that is currently occurring in DES models. And thank you. Any questions?